name is Jessica and I'm 43, and I probably was diagnosed 20 years ago when I was in my early 20s. I would say besides fear and anxiety for sure, I would get UTIs, some pain. In February, I had labs done and my GFR was 58 and the creatinine was 1.2. It had dropped to 50s from being in 60s for a long time. My numbers were declining and I started getting talks about starting a medication, and the fear kicks in and I'm like, I have to try something besides medication because the medication doesn't have as much hope. And this is where I was like, I have to. I kept on something that kept budging me to try it and to start it. And that's where if something led me here. Just getting my blood drawn July 14th and big progress of GFR of a 74, and the creatinine went down to 0.95. For sure, eating more healthy, getting more ideas and sticking to it, which in the past I had started somewhat keto and never stuck to it. And because I guess I couldn't get rid of the cravings. I think for sure those were wins because I learned a lot and I learned what to eat and no cravings for sure. Like the cravings are gone. Favorite part was for sure meeting every week and I guess talking about similarities and things that we go through, right? Because it's also good to see that we have other people out there that are going through the same things. Because for me, I don't have anyone really to talk to about this besides a doctor. And it's an awesome thing to see other people that, are doing this and are trying to help and are trying to make a change for everyone else that's going through this and feel alone and only hearing the doctor's side of, their doctor's side of view of this disease, which is just wait, and that's not what I think this program is not about. Just wait, it's do it now, take control of your life, and it provides hope because your numbers do change. I feel, even if it's not a big number change, but any increase is good. My numbers haven't increased for years, and just doing this since March, and my numbers increased by a lot. It is an expense, but I feel like your health should be number one. You're eating healthy, you're sleeping better, you're not losing hair like I was in the past because I wasn't eating properly. The one thing that stuck out to me in the beginning of my class was that someone mentioned hope, which the first class, I didn't even have my camera on because this whole PKD was very touchy thing for me. But when the word hope was on, I was in tears because that's exactly what we're all looking for, I think. And this program for sure gives us that because there's numbers that don't lie and they change. And it just gives you that push to know that this is what we need besides just waiting for numbers to be so low and have no other choice but to get, the worst news that we don't want to hear. My anchor statement was healing is within my choices and my reach. It might be hard in the beginning or it might be fearful, which I was full of it in the beginning because I was like, I'm not going to be able to do it. I'm going to be bored. I don't know. I'm not going to be able to eat these things. And it absolutely isn't like that because it becomes easier. In every class, you learn so much. There's just so much things that you can do. And, you're taking control of your life. Instead of just sitting here, you're fighting the disease back and not feeding it. And I feel that's one of the biggest things that we need.